Dear colleagues, today we present the case of a patient who came to our attention for a suspected heart disease in the second trimester of pregnancy. As you can see from the apical four-chamber view, the presence of an ostium primum type atrial septal defect is clearly evident, meaning it involves the septum primum, that is, the most proximal part of the atrial septum, the one closest to the valves. The peculiarity of this case is the coexistence of a dilated coronary sinus. As you can see from the images on the left side of the screen, which we are now going to measure, there is this structure, which is a dilated coronary sinus that, passing behind the left side, displaces the septum primum and in some cases can give a false impression of an atrial septal defect. And for this reason, it is important to carry out a careful study to avoid making an incorrect diagnosis. However, upon careful examination of the cardiac anatomy, you can see how the defect of the septum primum is evident, as well as the loss of valvular offset. That is, the mitral and tricuspid valves are not misaligned but are on the same plane. In fact, the ostium primum type defect is also called a partial atrioventricular canal. In fact, the mitral and tricuspid valves, unlike in the complete canal, are two distinct valves, but there is a loss of their offset. However, we clearly need to investigate the cause of this dilated coronary sinus, so we will conduct a thorough study of the cardiac anatomy, which shows us a normal duct of Arantius, but above all, we will look for causes that could explain the dilation of the coronary sinus. Therefore, we will check for the possible presence of a persistent left superior vena cava or an anomaly of the pulmonary veins. In this case, you can see that there are pulmonary veins draining normally. We can see at least two of them on the screen, draining into the left atrium. And this allows us to rule out a total anomalous pulmonary venous return of the cardiac type, which would explain the dilated coronary sinus. But it is an important diagnosis because it can represent a neonatal emergency. But again, observe, you can see the coexistence of the defect and the dilated coronary sinus. The entire study of the cardiac anatomy ruled out the presence of other associated heart defects, but above all, as you have just seen and continue to see, in the mediastinal scan of the three vessels, there is no persistence of a superior vena cava left, which is one of the most frequent causes of coronary sinus dilation. Again, we try to identify a cause for the dilation, but even in this case, as you can see in the bicaval scan, there is a normal superior and inferior vena cava in the left atrium, as well as a normal course of the right subclavian artery. The entire study of the cardiac anatomy did not reveal any other anomalies. I haven't shown you the images, but it was a perfectly healthy heart except for the anomalies I have shown you. So what are the types of atrial septal defects? Septum primum, which I have just shown you, which is the partial atrioventricular canal, septum secundum type, when it involves the uppermost part of the atrial septum, or those of the sinus venosus or coronary sinus type, which are difficult to diagnose prenatally. In prenatal management, it is clearly necessary to perform a detailed examination of the cardiac anatomy to rule out associated anomalies, especially due to the risk of complex heart diseases such as aortic coarctation. Prenatal follow-up is needed, and above all, genetic counseling should be recommended because the partial atrioventricular canal, as well as the complete form, carries an increased risk of association with aneuploidy, particularly trisomy 21. Therefore, invasive testing for fetal karyotype should be offered. Obviously, it is also necessary to recommend pediatric cardiology and cardiac surgery consultations, even though defects of the interatrial septum generally have a good prognosis from a surgical standpoint. In this case, however, we still noted in the report that it was not possible to rule out the presence of a partial anomalous pulmonary venous return during the prenatal period. Thank you all for your attention.